Hello everyone. Welcome to our medical education series. Today, we are going to discuss a very important and life-threatening condition in early pregnancy called ectopic pregnancy. Many women are not aware of this condition, and because of late diagnosis, it can become extremely dangerous. So please watch this video till the end, because early detection can save a woman's life. What is ectopic pregnancy? Ectopic pregnancy is a condition where a fertilized egg implants outside the uterus instead of implanting inside the uterine cavity. In a normal pregnancy, the fertilized egg travels through the fallopian tube and implants inside the uterus, where it can safely grow into a baby. But in ectopic pregnancy, this fertilized egg gets stuck on the way and starts growing in the wrong place.
Where does ectopic pregnancy occur? In about 95% of cases, ectopic pregnancy occurs in the fallopian tube. This is also called tubal pregnancy. Other rare locations include the ovary, the cervix, the abdominal cavity. However, none of these places are designed to support a growing pregnancy.
Normal pregnancy versus ectopic pregnancy. Let us understand the difference. In a normal pregnancy, implantation occurs inside the uterus. The uterus can stretch, has good blood supply, and supports fetal growth. In ectopic pregnancy, implantation occurs outside the uterus. These areas cannot stretch properly. As the pregnancy grows, it causes tissue damage, rupture, and internal bleeding. This is why ectopic pregnancy can never become a normal baby and must be treated immediately. Why does ectopic pregnancy happen? Now let us understand why ectopic pregnancy occurs. The most common reason is damage to the fallopian tube. If the fallopian tube is inflamed, scarred, or blocked, the fertilized egg cannot travel properly to the uterus. Common causes. The common causes include pelvic inflammatory disease, also called PID, genital tuberculosis, which is very common in India, previous ectopic pregnancy, previous pelvic or tubal surgery, infertility treatments like IVF, endometriosis, smoking, and congenital abnormalities of the fallopian tube. All these conditions interfere with the normal movement of the fertilized egg.
Risk factors. Some women have a higher risk of ectopic pregnancy. These include age above 35 years, history of abortions, use of copper T or intrauterine devices, multiple sexual partners, previous pelvic infections. But remember, ectopic pregnancy can also occur without any risk factors. Symptoms of ectopic pregnancy. Let us now talk about the symptoms. Early symptoms. In early stages, symptoms may look like a normal pregnancy. These include missed periods, positive pregnancy test, mild lower abdominal pain, light vaginal bleeding or spotting. Because of this, many women ignore the symptoms. Dangerous symptoms of rupture. When the ectopic pregnancy grows, it can cause the fallopian tube to rupture. This leads to severe internal bleeding. Danger signs include sudden severe lower abdominal pain, pain radiating to the shoulder tip, dizziness or fainting, cold sweating, low blood pressure, signs of shock. This is a medical emergency.
Why ectopic pregnancy is life-threatening. The fallopian tube is thin and cannot stretch like the uterus. As the pregnancy grows, the tube ruptures and causes massive internal bleeding. If treatment is delayed, the woman can lose a fallopian tube. Severe shock can occur. Death can occur due to blood loss.
This is why ectopic pregnancy is one of the leading causes of maternal death in early pregnancy.
Diagnosis of ectopic pregnancy. Early diagnosis is the key to saving life. Doctors use the following tests. Pregnancy test. Urine pregnancy test will be positive. Beta-hCG blood test. In ectopic pregnancy, beta-hCG levels rise slowly. Do not double normally. Transvaginal ultrasound. This is the most important test. Findings include empty uterus, no gestational sac inside uterus, abnormal mass in fallopian tube, free fluid indicating internal bleeding. Treatment of ectopic pregnancy. Treatment depends on size of ectopic pregnancy, hCG levels, patient's condition. Medical treatment. If detected early and the patient is stable, doctors use methotrexate injection. This medicine stops the growth of pregnancy tissue. This method avoids surgery but requires close monitoring and repeated blood tests. Surgical treatment. If the ectopic pregnancy is large or ruptured, surgery is required. Surgery is usually done by laparoscopy. Two procedures are possible: salpingostomy, pregnancy removed, tube preserved; salpingectomy, affected tube removed. In emergency cases, open surgery may be required. Future pregnancy after ectopic pregnancy. Many women worry about future fertility. The good news is, pregnancy is possible after ectopic pregnancy. Many women have normal pregnancies later. However, risk of recurrence is about 10 to 20%. Early ultrasound is compulsory in next pregnancy. In some cases, IVF may be advised. Prevention and awareness. Ectopic pregnancy cannot always be prevented, but risk can be reduced. Important steps include early treatment of infections, avoid smoking, regular gynecological checkups, early pregnancy scan. Never ignore pain or bleeding in early pregnancy. Final message. Ectopic pregnancy is a silent but deadly condition. If you have missed periods, positive pregnancy test, pain, or bleeding, do not delay. Early diagnosis can save your life. If you found this video helpful, like the video, share it with others, subscribe to our channel for more medical education. Thank you for watching. Stay informed, stay safe.